and welcome to Ark and Dove Presbyterian Church here in beautiful Odenton, Maryland. I'm Brian Boudreau, the Clerk of Session at Ark and Dove, and your host here in the lobby, the weekly program of the goings-on at Ark and Dove. And boy, do we have a lot going on this week. Today is the 15th Sunday after Pentecost, and we will be celebrating communion. So please get your bread and fruit of the vine ready. That can be grape juice or wine. So it has begun. This week we had 2 in-person meetings at the church on Wednesday and Friday evening. Well, on the church premises, that is, right? We covered our faces with masks, and we were armed with lawn chairs, and both groups met outside around a campfire. So I should note that for all in-person activities, participants must sign a covenant affirming their commitment to wear a mask and to practice safe social distancing. But as we are into full swing with our kids back to school and the weather starting to cool off, Ark and Dove has a full slate of virtual and in-person offerings for you. So let me share some of those things that are going on. Godly Play starts this week for children grades K through 5. Classes take place via Zoom on Sunday from 9 to 9:40, and our Godly Play team has put together response bags containing art supplies and other materials for children to keep at home for personal use. So while the bags were available earlier this week for pickup, arrangements can be made if you don't already have a bag to be delivered to you. If you have any questions about Godly Play or would like to be put on the list to receive our Zoom invitations, please contact Julie Devers, the Christian Education Elder. The high school youth group, that's grades 9 through 12, will kick off this Sunday, September 13th. That's tonight, meeting in person outside in the field. But there will also be a mix of online and in-person gatherings going forward as safety permits. So all the youth wishing to gather in person outside will be asked to sign that covenant that outlines our safety precautions. So please contact Pastor John for any questions. Logos will be starting on September 22nd. It will take a different format this year with online and in-person outside meetings. It will be 4-week rotations with YouTube videos, Zoom meetings, and family-inclusive activities on the church grounds. The first Logos event will be on the 22nd with a spiritual walk around the church campus. To learn more about Logos, there will be a meeting this coming Tuesday, September 15th. So you can contact Jen Roman for the Zoom invitation. You can join Pastor John, Katie Nelson Johnson, and Grant Johnson for a new series exploring conflict and how it might help us today. Katie herself has received a master's in peace and conflict studies. This is a 5-week course that will explore conflict at all levels, from international to interpersonal. The next session will be on Tuesday, September 15th, so you can contact Pastor John for a Zoom invitation. Ark and Dove members and friends are invited to participate in the 1,000 Men March in Annapolis on September 19th. The march is not only for men, all are welcome, and masks and 6-foot social distancing are mandatory. So carpooling will leave from Ark and Dove, and for more details, you can go to the e-archive and follow the link there. Here is one for anybody who uses email or goes online. With so much of our personal and professional business conducted online, it is more important than ever to maximize our awareness of personal safety and security risks associated with using the internet. So please join us for a 3-part online computer safety class starting on September 22nd and sessions on the 29th of September and October 6th. These will be at 8 p.m. via Zoom. The Disciple Ministry has invited Joe Gray and Sean Futch to discuss phishing, social media security, and hacking at these sessions. So please contact Trisha Gray to sign up. There's also a new book group for adults being offered on September 30th. We'll be reading White Too Long, The Legacy of White Supremacy in American Christianity by Robert P. Jones. Whether you read the book or not, you are invited to bring an open mind and open heart to our next book group via Zoom meeting on Wednesday, September 30th at 7 p.m. So you can sign up by emailing Pastor John or Kim Champagne. Beginning on October 27th, Pastor Tim will be leading a 5-week experience on ancient prayer practices on Tuesday evenings at 7 by Zoom. The book will be Creating a Life with God, The Call of Ancient Prayer Practices by Daniel Wolpert. That can be ordered on Amazon or through the website heartsandmindsbooks.com. So please contact Pastor Tim to register and receive a Zoom invitation for that. Now, with more activities taking place at the church, the facilities team is looking for more volunteers to join the team. So no experience needed, and we have both indoor and outdoor teams. So contact Autumn Vernon to sign up. Kim Champagne will be leading a book group starting in October on being grateful in difficult times. That's very timely. The group will read Diana Bass's Grateful. Class size is limited, so sign up now by contacting Kim Champagne. Do you ever have questions about the Bible readings during service? Well, every Wednesday at 10 a.m., we will gather online for fellowship, Bible study, and upcoming Sunday scriptures and prayer. Pastor John will be leading that. You can email him for a Zoom invitation. Now, calling all knitters and crocheters, please join us for a virtual get-together and bring whatever project you are working on. We are a laid-back group that hopes to support and inspire creativity during these times in social distancing. The group will meet on the first Wednesday and third Monday evening of each month from 7 to 8 p.m. You can contact Amy Tardif to sign up. As always, there are many more Zoom activities that you should know about. They are in the e-archive, and some of them I want to highlight are the Sunday Fellowship right after the live stream service at 11:15. If you don't have an invite for that already, you can email fellowship@arkandove.org. It is a recurring event, so if you've already received the invitation once, you can go back to that email and click on that. Saturday night, game night with the deacons. You can contact Ellen and Greg Makar to get a Zoom invitation for that. And as always, the Friendly Seniors Tea at 3 every Thursday via Zoom. Pastor Tim can send you an invitation to that. So after all of that that's going on, I'd like to welcome this week's guest, mom and nurse Becca Distad. So Becca, thank you for joining us today.
Thanks for having me.
So Becca, just real quick, how's the family doing?
We're doing really well. Just kind of figuring out how to navigate, reintegrating into kind of, normal life, but just trying to do the best that we can. And, but we're overall doing really well. We're healthy and have been happy. So that's the most important thing.
Well, the reason why I invited you on the program today is because you are a nurse. And one thing we haven't talked about on the lobby yet is the experience of our medical care professionals are going through during the COVID-19 pandemic. So could you just give us maybe a little bit of background of your experience?
Sure. So through this pandemic, and for the past 6 years or so, I've been working on labor and delivery as a nurse at Anne Arundel Medical Center in Annapolis.
Okay, great. So you have been in the thick of it. So can you describe to us, like, if you can, what were those initial days like back in March, April, May, when the pandemic was, at its peak?
To be totally honest, it was terrifying. We kind of just, I don't know, we didn't really know much about anything with the virus. And I think that kind of the fear of going into work, and we obviously wanted to be taking care of all of our patients to the best of our ability, but have been trying to protect our own families too and ourselves. And I think the biggest fear factor of it all was just kind of, we are in the, like you said, in the thick of it and trying to take care of our patients the best of our ability. And that puts us very close contact with them. And that's part of the job that we love, but then being fearful to then take the virus home to our families. And for me, having a 1-year-old at home, it was just amplified even more. I was more worried about him than myself even. So just kind of navigating that was the hardest part.
So what did you have to do during that time period in terms of, like, a PPE, protecting yourself? Did they have enough supplies for you at the hospital?
So at the very beginning, we had enough From the beginning. At first, it was kind of the hard part was nobody knew exactly what we needed to do to protect ourselves. So the standard was kind of a surgical mask, and then it upgraded to our respirator masks. And for a little while, we had everything we needed, and then the kind of the panic of the supplies running out, and that really scared everybody even more. But so we now are still wearing our respirator masks if we're within 6 feet of our patients. I am very cautious, and being with laboring moms, I hate that they have to wear masks while they're laboring. So I tend to personally wear my big respirator mask all the time, so that then if they need to take it off to take a breath or something like that, they can. But we wear our masks. If we have a patient who tests positive, then we up our protective gear a little bit more. But mostly just honestly trying to make it less scary for the patients too, of taking it all seriously, but not scaring them with everything we're wearing, because it's just so different from anything else. We have shields that we wear too, and eye protective gear if we need it, or if, like I said, if we're kind of in close proximity with our patients too.
So are patients then tested regularly for COVID-19, and how about the staff? Do you guys have tests, or do you only have tests when there's a concern of exposure?
Yeah, so we typically, at Anne Arundel at least, every hospital is a little bit different, I would think, but at Anne Arundel, we test any patient who is admitted to the hospital. So even if I have like a laboring mom that comes in to triage or is admitted, she'll be tested just kind of automatically when she's admitted. Now, every patient has a choice if they want to be tested or not, but we do strongly encourage them to be tested while they're there. And then staff-wise, we're really only tested if we have a potential exposure or if we develop any type of symptoms. The hospital is very on top of making sure that we're constantly checking ourselves and doing kind of temperature checkpoints, symptom checkpoints, and just making sure that if we're coming into work, we are healthy and we're not exposing anybody to anything more.
Right. So how would you describe today compared to 4 or 5 months ago? I mean, obviously we know a lot more about COVID-19 today. So how would you describe the situation today?
I think it's a lot more under control. It's still kind of scary sometimes because at the end of the day, it's changing daily, weekly, but it is much more under control. It's a lot safer to be, or I guess I shouldn't say safer. It's a lot more comfortable to be in a hospital right now than at the beginning. And it is much more under control.
Oh, that's great to hear. Mm-hmm. So I've not personally been to a hospital recently, and if people need to have procedures, they certainly should not be scared away right. Because of COVID-19. So for patients or guests of patients, what advice do you have for them?
So it's ultimately not going to be all that different from like going to a grocery store. I don't want to downplay it at all. It's still very important to protect yourself coming into the hospital. But if you wear your mask and socially distance the best that you can, wash your hands, those are going to be the best things that can protect you. Just like if you were going out to the grocery store or something like that.
So as a mom, right, you like you said, you have a 1-year-old, Bennett. How do you approach then the COVID-19 protocols?
He's our first child, and I've always heard that it changes your whole life, but it very much does change how I view everything. So we've been very conservative. I've been talking to his pediatrician quite a bit, just kind of checkpointing with him to know exactly. It's so hard to know what the right move is for all of this stuff. So ultimately, we're just doing the best that we can. We've been pretty conservative just because it's what we're comfortable with, but but otherwise, just doing the best we can with the information we have.
Yeah. Yeah. And that's exactly it, right? I mean, you go with your comfort level, and use your gut as your guide.
Yes.
Well, thank you, Becca, so much for joining us today. I can't express enough our gratitude for what you do every day. And to all the healthcare professionals out there in the congregation, we'd really appreciate it. So thank you, Becca, for joining us today.
Thank you.
And thank you for joining us each week. It's truly a pleasure to be able to talk to you. Don't forget about the Sunday Fellowship after service. Have a great week, and the live stream service will begin momentarily.